Good morning. My name is Kristen and I will be your nurse today. I'm just going to verify your name and date of birth. Can you tell me your name? Millie Larson. Yep. And I have your MAR right here and it does say Millie Larson. Okay. And your date of birth. 01/01/1936. And fantastic. Right here it says 01/01/1936. So let's get started. Today I'm going to be administering a few different medications for you. What I'm going to do first is I'm going to perform hand hygiene, and I'm also going to prepare those medications. After I prepare them, I'll explain to you what exactly I'm going to do and what each medication is for. Let me first start by putting on gloves. And the first medication I have here is going to be Dulcosate 100 milligrams tab, and that's oral. So I'm going to get my medication. I'm going to look at the back and make sure that it matches. And this does say 100 milligram tab, oral, okay. And it is for Millie Larson. So we're going to put this medication right here in the medication cup. That's going to be for me to give a little bit later. And then the next thing I'm going to do is I'm going to be preparing insulin Lispro. It says 10 units. It's going to be subcutaneous with breakfast. So I'm going to get my insulin right here. And this is correct. It does say insulin Lispro, also known as Humalog. All right. And I'm going to get my insulin needle right here. Okay. First thing I'm going to do is prep the vial. I'll remove the cap. Clean it with an alcohol pad. Okay. And my needle. And as you can see, this is an insulin needle. So again, it is going to be 10 units. So I'm going to take the top off and I'm going to draw up 10 units here. Okay, and I already cleaned the top, so that's good. Remove 10 units. And I'm just going to make sure all the air is out of the vial. And it is. Okay. So that is all set. I'm also going to label this. And this is insulin Lispro. It's 10 units. I want to do this for safety of the patient, make sure I know what medication is in what needle. So that's right here. I've already labeled that. I'm going to put that out. And we're all set with this vial of medication right here. Okay. The next medication I'm going to be preparing is haloperidol, and it says 2 milligrams intramuscular. So here's my medication, and this does say haloperidol, but it's 5 milligrams per ml. So I'm going to calculate because I only want 2 milligrams, and here is my needle, and my needle is in mLs. So I'm going to take the 2 milligrams and I'm going to divide that by 5 and I get 0.4 mLs. So when I'm drawing up the dosage of haloperidol, I'm only going to draw 0.4 mLs. Okay, so again, I'm going to prepare the vial, take the cap off, use my alcohol pad in the top. And as you can see, this is an IM needle. Make sure I have all the air out of there. And that is 0.4. So that is prepared also. And again, I'm going to label it so that I know that this particular needle has Haldol in it, 0.4 mLs. That's for the safety of the patient. So I'm just going to clear all of this out of here. And I don't need this anymore, so I'm going to put that to the side also. Okay, so let's just verify one more time. I have my 3 medications. I have the Dolcosate, that's going to be oral. It's a 100 milligram tablet. That's all set. I have insulin Lispro. It's 10 units. This is going to be subcutaneous. Again, 10 units. And I have my haloperidol. This is going to be 2 milligrams intramuscular, but again, it's only 0.4 mLs in here. So we did the math on that. All right. So I verified. I'm going to remove my gloves. Throw those out and perform some hand hygiene. Okay, at this point, I would be going into my patient's room again. I'm going to shut the curtain so that we have some privacy. Hi, Millie, it's Kristen again. I just want to verify your name and date of birth one last time. We're going to get you started with some medications here. So, yep, Millie Larson, 01/01/1936. And right here I have Millie Larson, 01/01/1936. Okay, so the medication administration record matches her armband, so we are all set to give medication. So, Millie, the first medication I will be giving you is a pill. It's going to be taken by mouth. It is called Dolcosate, also known as Colace, and it's given as a stool softener. So I'm going to get you some water, and then I'm going to go ahead and let you take the pill. Okay, so here's some water for you. And this is going to be the medication. You can just take that for me. Okay. Great. Thank you. Let me just dispose of that. All right. So the next medication I'll be giving you is insulin Lispro. Let me put my hygiene here. And I'm going to put my gloves on for this. So insulin Lispro is also known as Humalog. It's used to treat diabetes. It's what's considered a fast-acting insulin. We're going to be giving this to you with breakfast. Okay, so I'm going to be using a small needle to inject the medication into your stomach. So first thing we're going to do, we are going to prep the site. And this needle is going to be going into the right upper quadrant. So we're approximately 2 inches from the navel. And we're going to just let this dry for a second. It's prepared. Okay. So again, I'm going to check this one more time. I have 10 units of insulin Lispro, matches the MAR, does say insulin Lispro, 10 units, sub-Q with breakfast. We have our patient, Millie Larson. So I'm going to go ahead and give her her injection. So I'm going to remove the cap. And I'm going to be pinching the skin. And we're going to go in at a 45-degree angle. And I'm going to just let it sit here for about 5 seconds. Move slowly. And I'm just going to engage the safety. And we're going to dispose of that in the sharps container. Okay. My gloves. Well, that wasn't too bad. Perform some hand hygiene. Okay, so the next injection that I'll be giving is known as an intramuscular medication. It's called Haldol. This medication is used to control agitation. So I'm going to be putting on some fresh gloves here. So this needle I'm going to be inserting into your hip. It's called the ventrogluteal muscle. It's just below the iliac crest. So it's on the side of the thigh. So I'm gonna have you lie on your left side. You can turn over for me. And I'm going to make sure I have my right patient, Millie Larson, again. And this is going to be 2 milligrams of haloperidol IM, which we already drew up and prepared, 0.4 mLs right here labeled. Okay. So my patient will be lying on their left side at this point. I'm going to be looking for the great trochanter. So I'm going to place my palm of my non-dominant hand on the great trochanter. And I'm going to take my index finger and point it toward the anterior superior iliac spine. So I'm going to keep these 3 fingers together, making a V. And I want to hold the skin taut. And I'm just going to clean the area inside the V because this will be where we're inserting this needle. I'm going to remove that. And this is going to be going in at a 90-degree angle. Administer the medication. Engage the safety. And again, I will be disposing of that in the sharps container. So I'm going to remove my gloves. Perform hand hygiene. Okay, Millie, so you're all set. I wish you the best and have a good day.